So a very warm welcome everybody to today's webinar, our first one of 2022. And today's topic is optimal breathing. Our presenter is the wonderful MS physiotherapist, Jennifer Pietersz. So very warm welcome to you, Jennifer, and thank you for doing our webinar today. And I'm your facilitator. I'm Nicola Graham. So it is with wonderful, great pleasure that I introduce you to Jennifer Pietersz today. So Jen is our senior MS physiotherapist. She's based in the office when we can get in Blackburn. She's been with MSL for a couple of years and she moved to Melbourne from Brisbane. Wide background in physiotherapy. Jen's worked with lots of different conditions. That's prepared her well for working with people with MS. She's got a very special interest in MS, in pain, in breathing, and in the areas of continence. So all really key areas with MS. And Jen has a real genuine passion for person-centered and holistic care. She brings over 6 years experience working with people to help them achieve their goals. I'm personally really looking forward to this webinar. The whole area of breathing and how we use it to manage our stress and our focus, etc., is so important. And I'm really keen to hear the content.
I'd like to, first of all, acknowledge the First Peoples and traditional owners and custodians of the land and water on which we rely, specifically the peoples of the Kulin Nation, where I live. I acknowledge and respect that Aboriginal communities are steeped in traditions and customs built on incredibly disciplined social and cultural order, which has sustained their peoples since the beginning of the dreaming. I pay my respects to their elders past and present for their role in leading the Aboriginal community. May we learn much from these people. So other personal acknowledgements that I have to make for today's presentation is to Trina Morris. Trina is a physiotherapist in Brisbane who actually first presented information to me about optimal breathing, and some of the slides and things from today actually come from her. And also to Campbell Will, who is another physiotherapist from Brisbane who specialises in breathing, who I've also learned some of my knowledge that I'm going to share today from him. So just adding a little bit to what Nicole said, I am a mum, I'm a physio, and I'm married to Hamish. So this is my son, Casper, and my husband, Hamish, and we like to go on bushwalks and play outside and have lots of fun, and I really enjoy reading. I'm a bit alone in that. But you'll see the backgrounds of the slides today, which I think they wanted me to change, but I specifically liked these because they just bring me into a place where breathing is really possible. So when I start to practice breathing, I like to actually picture myself in a place like this, you know, with mountains and streams. And sometimes it's pictures like this that look like they're in Canada or somewhere, and other times it's, you know, in Australian locations and things. So, but it's just really worthwhile to remember that. So why are we talking about breathing, and why should you put your time and effort into learning about breathing and learning to breathe? And the most important question is actually, why wouldn't you? Breathing is free, it's accessible, it's instantaneous, meaning that it can have an instant effect, and it's a really safe thing to do. It's something that we all have to do to actually survive. So what does breathing offer you? It's a simple exercise. It offers initiation of change. So it can actually change how we feel and how our bodies are responding to situations, and how we can actually achieve things. So it's really, breathing is really something that we can use to increase our hope and our positive outlook on life. It's a self-management tool that we can integrate into our lifestyle, and it's very simple, but it is also really empowering. When you start to practice breathing, it's really something that you can use to help you achieve your goals. So which brings us to the last thing. It really offers you an improved quality of life. So it's an exercise that you can practice anywhere, whether you are sitting, whether you're lying in bed, whether you're walking, or whether you are trying to do some exercise that's challenging for you. So you can practice it anywhere. So today we're just going to talk about what we can learn about breathing. I'm going to talk a bit about the mechanics and anatomy of breathing and changes that can happen when you have MS to your breathing patterns. I'll talk a little bit about functional and dysfunctional breathing, the role of the diaphragm, what happens in vagus, so a bit about the vagus nerve, and different breathing patterns. We'll do some practice, and I'll give you some exercises to take home. So just a little bit about breathing anatomy. Breathing is driven in your body by your lungs, your diaphragm, other muscles of respiration, which you can see pictured on the right, and your brain. So we will touch a little bit more on the diaphragm, but I just wanted you to have an understanding that there's actually quite a lot of things that contribute to breathing, particularly here where we see the muscle, these accessory muscles for inspiration, and muscles that help us when we are doing active breathing, when, like if we need to, when we're puffing and doing things like that. The main breathing muscles that we have are the intercostal muscles, so the muscles that sit in between our ribs, and they work when we're doing quiet breathing. So when we're really puffed, so you see people at the end of a race or something, and they're bending over, they've got their hands on their knees and they're really puffed. They're using their shoulders to heave and help them breathe. So they're using these accessory to breathing muscles to help lift their rib cage to help them get more air into their lungs. And we can also when we're doing that active breathing, we use our abdominal muscles and some of our back muscles to help also depress or lower your rib cage to help increase your breathing. So breathing mechanics, it sounds quite simple, but it's good to actually think the process through. Inspiration is breathing in and expiration breathing out. And they're vital for providing oxygen to the tissues and removing carbon dioxide and other waste products from our body. Inspiration occurs via the active contraction of muscles, such as the diaphragm or your accessory to breathing muscles, whereas expiration tends to be passive unless it's forced. We'll look a bit more into this in a moment, but most importantly, we should remember that breathing is mostly an unconscious function. It's something that we do without even thinking about it, but we also have conscious control over it. And this is where breathing becomes something that we're practicing. Breathing can be really influential and really make changes in our life that I talked about earlier. So in MS, the most common cause of respiratory problems in MS is the loss of muscle strength and endurance. Now, muscle strength and endurance, we kind of think, when you're thinking about your strength and your endurance, your muscles, we talk about your arms and your legs and your back muscles, holding you up straight and holding your posture, but actually your respiratory muscles are really important as well. And we can lose the strength and endurance in your respiratory muscles just as you can lose strength and endurance in your other muscles in your body. So this is a bit of my opinion. People with MS are often, it's actually proven that 80% of people who have MS aren't as active and don't meet the recommended activity guidelines, exercise guidelines. And with that, that means that often this progresses their disease earlier than we expect. So it's really important to actually look at breathing and the incidence and how that actually impacts us in being able to achieve our goals. And considering this, looking at fatigue as well, fatigue being a major symptom that affects up to 80% of people with MS, and how breathing can actually impact fatigue and improve your cognitive function and improve how you feel even just in the moment. So another interesting fact about breathing in MS is that there is an increased incidence of obstructive sleep apnea and central sleep apnea. So that's where you stop breathing while you're asleep in people with MS who have lesions in their brain stem. So there's lots of really interesting studies that we could look at, but we don't obviously have a lot of time today. I would like to talk briefly about this one study in particular. So this study looked at pulmonary function, so lung function in people with MS who don't have respiratory complaints. So they did this study. The reason they did it was that pulmonary complications in severe MS are often seen secondary to respiratory muscle dysfunction. So that means you get lung complications, like you might get pneumonia and things like that, but that's caused by the respiratory muscle dysfunction. So the study objective was to detect deterioration of respiratory muscle function in early phase MS, so before people get to that the later stages. So the study looked at 21 people with MS and 17 healthy subjects who were matched for their age and their smoking habits. And it tested the pulmonary function, their lung volumes, diffusion of gases, so the way the gas passes from our lungs into our bloodstream, and the respiratory muscle function. So the results of this study were quite interesting. So in all the parameters of the test, so looking at their lung volumes, their lung function, diffusion, and their respiratory muscle function, all of those parameters were lower in the MS group, so they performed worse than in the control group. They also found that in the MS group, the forced vital capacity, which is the total amount of air exhaled during the forced expiratory volume, so how much you can blow out, was higher when they were sitting up than when they were lying down. So this is important because the difference was significant in this group between the MS group and also against the control group. So the MS group was significantly worse in terms of the percentage difference between their sitting up and their lying down forced vital capacity, how much air they could blow out. So the lung function of people with MS in this study, it's a small study, but it did definitely show that there was some interesting differences. And I really think that this is an area that should be looked at more in terms of MS, because breathing, as we've sort of looked at already, is such a vital role, plays such a vital role in our body function. So, talking a bit more about the mechanics of breathing now, the primary function of the diaphragm, your breathing muscle, is respiration, but it also plays an important role in many bodily functions. So in terms of the musculoskeletal system, it's a really vital muscle. It's what drives our breathing and our ability to exercise. Cardiovascularly, obviously, it's important. It's the muscle that helps us to breathe. So we'll look more into that in a moment. It also plays a function in the lymphatic system. It's vital for your postural stability and also in your digestion. So we'll see these come up again later when we're looking at the effect of breathing in our everyday lives. So just to have a bit of a closer look at the role of the diaphragm. The diaphragm is a skeletal muscle, and it separates the thoracic cavity from the abdominal cavity. So as you can see, it's a dome-shaped muscle here that divides the cavities. It may sound simple, but in fact the diaphragm is much more than just a sheet of muscle. it plays an impact in every breath you take. Every breath you take is driven by the diaphragm. It's the chief muscle for inspiration, so breathing in, and which means that when it contracts, it helps us to breathe. During contraction, the central portion of the diaphragm depresses, so it lowers, increasing the volume of the lungs above, which causes a vacuum to help us draw in air. So it's quite a nifty little thing. It's, you know, it's not this simple kind of piece of muscle. It actually has a large impact on what happens in our body. So when we breathe out, your expiration, as I said, is largely passive. The diaphragm rises, the dome of muscle rises, which decreases the volume in your thoracic cavity, in your lungs, and increases the intrapulmonary pressure, so the pressure in your lungs, and which forces air to be expelled. So as the diaphragm rises, it forces air out of our lungs. So it's actually quite fascinating to look at the way that the diaphragm works in our body. As I said before, we can see that there's also some openings in the diaphragm where vital organs and things like your arteries and veins and your esophagus pass through, and that can play a really important role in our breathing, in our bodily function. You can also see here that the diaphragm actually attaches to the front of the spine, which is really important to know because it helps to stabilize your spine, and it helps with, and that's why sometimes when you are trying to do something that requires stability, it's hard to breathe at the same time. So we talk about patting your head and rubbing your stomach. When you're trying to stabilize your spine, if you don't practice breathing, it's a bit like patting your head and rubbing your stomach. You have to learn how to do it again. Okay. So another little interesting nugget for you is the neural innervation of the diaphragm. So the diaphragm is obviously driven from your brainstem, but it also has innervation from your cervical spine and your thoracic spine. So if we think about lesions again, and in your spinal cord from MS, if you have a lesion in the area of C3 to C5, that can impact your diaphragm, but also having a lesion through the thoracic section can impact on your breathing. So I just wanted to mention, for example, if you think about your diaphragm, Christopher Reeve, he had a spinal cord injury. Most people know who he is. And his spinal cord injury was very high. It was at C1-2. As you can see, that's actually above the innervation for the diaphragm, and this is why he could no longer breathe on his own without a machine. So because the muscles that drive his diaphragm to rise and lower, to cause inspiration and expiration, the nerve messages weren't getting through. So it's a pretty interesting thought that we can have. Let's look at breathing patterns and variations. So there's lots of different breathing patterns, but in terms of anatomy, we talk about breathing abdominally, which we use when we're doing something like singing, and thoracic or lateral costal breathing, where your rib cage moves out, versus your upper chest pattern of breathing, which is what you use, as I said, when you're really puffed, or for someone who's really not fit and they're feeling very short of breath, they'll often breathe up here. So another variation that we can have is mouth breathing versus nose breathing. So when we talk about breathing through, I'll come back to this a bit more, but it's just important to note that there's quite a difference between breathing through your nose and breathing through your mouth. So one last little visual of breathing. So here we can see in the first image, the air is going in through your lungs, which causes your diaphragm to depress, to go lower, to contract and draw down, which increases the amount of volume that you have in your lungs, and your abdomen expands. Think about that, you know, it's kind of funny when you think about it. Everyone says breathe in when you want to get skinnier, but actually we don't want to breathe in when we want to get skinnier. We want to breathe out to get skinnier, because that actually, as you can see in the second image, as you breathe out, your abdominal wall contracts, your rib cage contracts, and your diaphragm rises, which decreases the amount of space in your lungs, airspace in your lungs. So do we have any questions at this time?
Thanks, Jen. We did have one question which I may have managed to answer, which was about when we're wearing a face mask, is that increasing the amount of carbon dioxide that we're inhaling, which I had a quick look at a study, and yes, it does, but it doesn't seem to be problematic. Have you got any thoughts on that, Jen?
One or two. I actually did want. I knew there was going to be a question about face masks, because I too, I've started actually wearing the N95 masks for work, which are a bit more restrictive than the surgical masks that I was wearing before. And like, we'll talk more about this, but you can actually get, I'm sure that if you live in Melbourne or even Sydney, we've been wearing masks for a long time, and you do get used to wearing the masks. So it's just important to be a bit mindful of the fact that when you are breathing with a face mask on, it's different. But it's not a bad, like, it's just that we need to maybe put a bit more effort into breathing. But actually practicing breathing is what will help us to cope with that. With regards to the carbon dioxide levels, it does cause a little bit of rebreathing, but at the same time, I haven't actually touched on this, but there's a really interesting fact in our body that our respiratory function, our respiratory rate, is actually driven by carbon dioxide levels in our body rather than the oxygen levels in our body. So when the carbon dioxide levels start to get too high, that's when you start to feel like you need to take more breaths. So for example, if in central sleep apnea, which is where your brain tells your body to stop breathing, that central sleep apnea is actually driven by carbon dioxide levels rather than oxygen levels. So on the one hand, it's something to be mindful of, but at the same time, our bodies are very complex in knowing what we need with regards to this stuff. So it's not something to be worried about. It's just, if you feel like you need to take a deeper breath, then take a bit of a deeper breath, but focus more on your breathing rather than on feeling breathless, because it's really can be quite helpful when you focus on your breathing, to help you feel like you're actually more in control and you're not so stressed about the fact that you feel like you can't get enough breath in. I hope that answers
Beautiful.
the question.
Yeah, that's lovely. Thank you, Jen. And thanks, Sue, for the question.
Yes, thank you. That's ask your questions away. I'm quite happy to answer questions. So moving on, we'll talk a little bit about breathing. So breathing is a really interesting thing that, obviously you are all interested in hearing about breathing because you're here listening to me now, but there's a few different ways that we can breathe. We can breathe rapid rate breathing. So, and that's associated with your fight-flight reaction. Often you have your mouth open. You might be gasping for breath or wheezing, and it's usually, as I said, a faster rate. So more than 12 breaths a minute, and it can be quite tiring because of this. So the muscles that help you breathe are tense and you feel more like uptight. It's inefficient because it's a shallow breathing. You can't get, if you're breathing really fast, you can't get that air down into the bottom of your lungs that you want to help for gas exchange. So it's just breathing from the apex of your lungs, which is the top of your lungs. your slow rate breathing, which is also, you usually do it through your mouth, and this can cause you to snore, or you might do a big sigh. So if you, like, when you're feeling stressed or something, and you just like, and that's, it has a place. Doing like sighing has a place. Snoring not so much, because that means that you're not getting that nice clear airflow in through your esophagus. And it's often a slow rate, so you might do 6 to 8 breaths a minute. It's what we do when we're feeling lethargic or in deep sleep, and it's kind of associated more with like drooping. You might feel more tired when you're doing that. It uses more energy than doing optimal breathing, and it's often abdominal. So as I said, like the slow rate breathing is not bad. It has a time and place. We use abdominal breathing, particularly in doing exercises like singing, and it's really important if you play like a wind instrument to be able to control your breath and not take so much, like not need to breathe at a normal rate, perhaps. But it's still not optimal breathing, which is what we're here to talk about. So optimal breathing is with your mouth closed, breathing just through your nose. It's a quiet breath, so you shouldn't hear someone breathing beside you when they're doing optimal breathing. So if you have a little practice, if you're sitting beside someone, you can listen into them, but you shouldn't really hear someone else when they're breathing. It's at a moderate rate. So we take 8 to 12 breaths per minute, and that's a normal rate of breathing. And we can do this breathing when you're sitting or standing or walking. So the muscles in your face and your neck are relaxed. It's efficient and it's effective. So because of that lateral costal breathing, so your costal, like that's your ribs, your rib cage expands, your diaphragm drops, and that extra pressure helps to get the air all the way down to the bottom of your lungs, to where most of the gas exchange takes place. So when you're breathing up the top, there's not a very large surface area for gas exchange to take place, where when you breathe deeper through optimal breathing, the air gets right down to the base of your lungs, and it allows for the most amount of oxygen to diffuse across into your bloodstream. So looking a little bit more at nose breathing. So breathing in and out through your nose, your mouth is closed, your tongue is on the roof of your mouth. This is a really important thing, because when your tongue is not on the roof of your mouth, if it's low, it actually makes your tongue bigger, and that can cause a bit of an obstruction in your throat, which, like as I said, that's what can cause snoring and things like that. So your teeth aren't touching, they're nice and relaxed. Your face and your neck muscles are relaxed, but also importantly, you've got your head sitting on top of your shoulders and your neck, so not with your chin poked forward. So let's just look a little bit about why nose breathing is important. So in this image, you've got pictures of your sinuses. And as you can see, your sinuses are actually quite wide ranging in terms of your the space in your head. The sinuses play a specific role in that they warm the air that you breathe in, so you don't get cold air when it gets to your lungs, which, you know, in Melbourne, in summer, the air is not too cold, but if you live somewhere really cold, if you're breathing in through your mouth, the air can be extremely cold. One of my friends lives in Norway, and she went for a walk. I was talking to her a couple of months ago when she went for a walk, and it was -20 outside, which is really phenomenal. I can't imagine -20. But, you know, if you breathe in like air that's -20 degrees Celsius and it gets to your lungs, that's freezing cold. And it's also dry. So your sinuses, being big sacs in your in your head actually warm the air as you inhale, so that the air gets to your lungs warmed as well. And cold, dry air can irritate your lungs, which can cause you to cough, and it can cause you to definitely cause feeling you to feel uncomfortable. Your sinuses have tiny little hairs called cilia, which help to filter debris and mobilize mucus. So the mucus that's created when you breathe in dust particles and other things like that, the cilia actually help you. So when you need to blow your nose and you blow mucus stuff out, that's actually called, built by your cilia. And most interestingly, I didn't actually know this before, but your sinuses produce nitric oxide, which is a vasodilator. That means that it widens the blood vessels, and that can help improve oxygen circulation in your body, which I thought that was a pretty fascinating fact. I learned that while I was doing this, preparing this presentation. So, a little bit of silliness. Don't breathe like Darth Vader. Darth Vader breathes heavily through his mouth, and he's grumpy, he's uptight, and you're more prone to illnesses when you breathe through your mouth. So I'm not going to do my best impersonation of Darth Vader breathing. We all kind of know what that sounds like. And yeah, so be a bit more like Yoda, breathing in through your nose and doing those practicing that breathing practice with your mouth closed, your tongue on the roof of your mouth, and your teeth not touching. Yoda doesn't have a very good head on neck posture. He's kind of sitting with his head forward, but we aim to be a bit more upright. It helps you to have a clear mind, and it really is empowering to breathe through your nose. So when you breathe through your mouth, you're more prone to breathing in particles of dust particles or germs, particularly in this day and age, you're a bit more likely to breathe in COVID particles and things like that we don't really want to do. Obviously, there's nothing we can do to prevent that except wearing a mask over your nose and your mouth, but certainly breathing through your mouth reduces that protective aspect of breathing through your nose. So your tongue will be low. It's your neutral resting position of your tongue is actually on the roof of your mouth. When your tongue is low, it actually gets bigger, as I said before. You often have that head forward posture. You can be more prone to colds and flus when you breathe through your mouth. You might have dark circles under your eyes, a bit more irritable and cranky. You can have poor memory and confusion. And you are more prone to headache and migraine, which can be partly because of that, the jaw aspect, because your jaw is very closely related to your cervical spine, but it's also talking about actually how you breathe. And you may also get more jaw pain from clenching your teeth or from not having your mouth closed. So disordered breathing may cause a reduction in your sleep quality, which can cause increased incidence of sleep apnea. Might cause, studies show that it increases psychological issues. It can increase psychological issues like anxiety and depression. It can cause reflux and increase your cardiac risk factors. It causes poor posture and it gives you a dysfunctional core, and that comes as much from the actual breathing itself as, remember what I said about your diaphragm attaching to your spinal cord and how that can impact your posture overall. So it increases your risk of infection and your risk of being congested or coughing, but most importantly, it increases sympathetic tone. So sympathetic tone is what we talk about when we talk about the vagal nerve. So vagal tone comes from the 10th cranial nerve. So cranial nerves are the nerves that mostly drive things that happen in your brain or in your head. So your blinking, your taste buds, your sense of smell, all those things come from cranial nerves. Your cranial nerve is actually the longest nerve in your body. No, the longest cranial nerve, 10, the vagal nerve is the longest nerve, cranial nerve. It passes from your medulla all the way to your colon, and it consists of sensory afferents, which take information away from the brain, and motor efferents, which take information towards the brain. It's located in your brainstem and the nucleus ambiguous. It's involved in the autonomic system function of your body, and it's a two-way street. It impacts your cardiac function, your heart rate, your blood pressure, and your respiratory rate, your gastrointestinal function, your endocrine system, and your immune response, and your respiratory system. They call it the Great Wandering Protector because your cranial nerve impacts all of these things, which are systems that work in our body to protect us. So, is there a relationship between vagal tone and poor health? The answer simply is yes. Looking at vagal tone, which we assess through, I'll show you how we assess that more in the next slide. We see heart rate variability, and that's a measure of the vagal nuclei. And studies have shown that there's an inverse relationship between decreased vagal nerve activity and increased incidence of rheumatoid arthritis, irritable bowel syndrome, atherosclerosis, Parkinson's disease, cardiovascular disease, diabetes, and early mortality. And I actually wonder if we looked further into MS, if there'd be any links that we could see in there as well. So in terms of assessing the vagal nerve and how it's functioning, we look at the heart rate and your blood pressure, your gut motility, food sensitivities that you might have. You might have lowered immunity and might be more sensitive to different things in the air, so like dust and things like that. But we also assess it by looking at your respiratory rate, as I said a moment ago. How do we stimulate and access the vagal nerve and to have an impact on our body? How can we access this to help us improve our quality of life? So a lot of different things that we hear about all the time, and I know with MS that we hear about, everyone says, oh, yoga fixes everything, and we all make a joke about it. And I actually think that it's pretty funny that people go, oh, have you tried yoga? Have you tried these things? But actually there is, unfortunately, there is an element of truth when we say that mindfulness and meditation, exercise, and yoga can really impact your feelings of fight and flight. And, you know, laughter is actually really good for us, for our mental health. Gargling is a really interesting thing, but that's because it does help to stimulate the vagal nerve. Music therapy, so singing, which actually is a form of breathing. Cold water immersion, which is that's another topic all on its own that we can talk about another day. But most importantly, in all of these things we do breathing. So we talked about this before. What does breathing offer you? It's a simple exercise that you can do anywhere. It's a way that we can change our bodies and change all of our systems in our bodies can be impacted by our breathing. It gives us, like I said, something to hope for. It's self-management, it empowers us, and it improves our quality of life. So why should we learn optimal breathing? So as I said before, spinal stability is influenced by intra-abdominal pressure because your diaphragm attaches to your spine. And intra-abdominal pressure is influenced by the passive structures, your ligaments, and the musculotendinous structures in our body, and also by the neural systems. Changing these three stabilizing systems may result in increased pain. And not everyone who has MS suffers from pain, but there's a moderate amount of people who suffer from pain of various kinds, whether it be musculoskeletal or pain purely from their nervous system. So studies looking to low back pain patients that showed that they have a reduced amount of lateral rib cage expansion and different breathing changes in chronic low back pain. So studies looked at reduced diaphragm movement, increased diaphragmatic fatigue, and decreased respiratory muscle endurance, and the increased incidence of low back pain associated with those things. So we're getting to some of my more favourite studies, if that's a way to say that. So looking at breathing training versus physical therapy. So there was a study that showed significant improvements in pain after 12 sessions over 6 to 8 weeks in people who did both breathing and physiotherapy versus people who just did physiotherapy training. There was clinically significant difference in the people who did the breathing exercise. And this is possibly one of my favourite things ever, that breathing training versus with manual therapy in people who had disordered breathing. So the prescription that they practiced was 30 breaths twice a day for 8 weeks. In both groups, they demonstrated improvements in the breathing symptoms, reduced anxiety, and improved breath hold length. But just like in the breath training group where they only did breath training, in both groups, they showed an increase in their 6-minute walk distance. But one group was only doing the breath training. They were only breathing, and I just think that's fantastic. They did 60 breaths a day for 8 weeks, and they improved how far they could walk in a 6-minute walk test. So does that make sense? Is that clear, Nicola? And is there any questions?
Yeah, I think it really shows how effective breathing is, and I'm looking forward to you taking us through in a bit more detail, Jen, exactly how we do that beautiful breath that will help us.
Yes. So, I skipped a slide. I've just got a few supports for your breathing exercises. We'll talk about how you breathe in a moment. So there's the Smiling Mind app. It's completely free, and it has some really useful guided breathing meditations on it. On your Apple Watch, there's a breathe function to remind you to breathe. There's an app called Balance, which is a mindfulness and meditation app that's got a free subscription this year, and it's really good. I've been using that. And one other thing that we'll talk more about is actually using tactile systems to help you breathe. So if you can see my hand, I'm tracing my finger to help you breathe. So we'll come back to this a little bit more shortly. So important things to remember as you do your breathing meditation is that meditation is learning to begin. Yes, I do like Star Wars a little bit. I'm a bit of a geek. I don't just like Star Wars, but Star Wars was appropriate for this. So when you notice your thoughts wandering, we go back to your breath. So as you do a breathing practice, I don't know if you've ever tried to count to 10 breaths. It's kind of hard. You might get distracted and start thinking about what you're cooking for dinner, or what's happening with your pet, or what's happening on that show on Netflix that you're watching, and we get distracted. So when you get distracted, just bringing your attention back again to your breath, and this is where using those breathing apps can be really helpful. So we're going to do some breathing practice now. remembering the principles of breathing we're going to practice optimal breathing. So your mouth is closed. We're going to practice breathing through your nose. It should be quiet. The rate is about 8 to 12 breaths a minute. As I said, you can do this when you're standing, you're sitting, or you're walking. You have a relaxed face and neck. It's efficient and effective, and we breathe from our rib cage. So we want to work towards expanding your ribs. So if you want to put your hands down on the side of your rib cage down here, and we will do the first exercise, which is box breathing. So sitting, we're going to breathe. So following the, Nicola, is the little dot moving around on the screen for you?
Yes, Jen, the little dot is moving beautifully.
Excellent. So we are holding our breath and now exhaling, breathing out. And hold and breathing in. So you keep practicing that and I'll keep talking. So box breathing is really helpful because it helps us to learn to control our breathing. So it's a good exercise to practice, and it helps us to increase our lung capacity and our lung function and improve how we actually breathe. So it's a good exercise to do when you're sitting quietly. And there's lots of different things that you can use on YouTube or in different apps that help you to manage your breathing. So now holding your breath and breathing in and holding and breathing out. So, and you can just repeat that. So count, 10 times. It's a good exercise. And this is the point where I wish I'd managed to put a poll in to see how you're feeling before you did the breathing exercise and if it helped you feel a bit more awake.
Well, Jen, people can type in their question area, their comments and their feedback, which would be wonderful. And having done that myself, I feel more focused and a bit more relaxed and a bit more present for doing that. And I'm wondering how long you might suggest we do that for, Jen.
So even just doing it for 3 or 4 breaths can be really helpful. So that's 30 seconds. It can help you just to wake up and feel more present, as you said, more alert, but not in a bad way. It makes you feel more, alive rather than alert, like in a negative way. So,
yeah, it's really lovely, Jen. I really like it. So Angela's saying, yes, I found this relaxing. It made me feel calmer. Monica's commented that the Exhale app is also excellent, and that's spelled Xhale. And Rosie's saying, thank you very much. It's really fascinating. She's loving it. Sue's commented that she was a bit of a mouth breather for most of her life. And then when she discovered that she was lactose intolerant, and that created a lot of mucus, a lot of nasal mucus, and now she's breathing easier. That's so much better. Yeah. Josh has got a question, Jen, here, and is saying, do consistent breathing exercises help with lowering inflammation in the body? That's an interesting question.
So theoretically, just from my knowledge and understanding, it certainly can, because what breathing does is it really helps you to calm your whole nervous system down, to calm all those systems down in your body, helping you to, so it can definitely reduce inflammation. I wouldn't say it's the only thing that we should be using, definitely. When it comes to managing MS, I talk about the different things that we should use to manage MS, being using your disease-modifying therapy and accessing that. Completing exercise, a routine exercise program that's specific for your level of function, managing your diet and intake, practicing mindfulness and getting your mental health in order, And that's really where this breathing comes in. It comes in a little into exercise as well, because it can help you achieve your exercise, but actually getting your mental health in order can be something else that we can do that can really help to reduce inflammation in our body. And the last thing, which also helps to reduce the inflammation in your body very significantly, is quitting smoking. So, which is another time when we want to be accessing breathing. So,
and I think if we can reduce sugar in our diet, that's shown to be anti-inflammatory. And of course, the Mediterranean diet is beautifully anti-inflammatory with the lovely omega-3s, flaxseed oil, and avocado and fish, etc.
Wonderful
Super.
thing.
Thank you, Jen. I love that box breathing. It's a lovely tool.
Yes. So I'm going to show you a different exercise to do. So pursed lip breathing, and we should use this exercise when you're puffing from exercise, or when you're feeling stressed and you can't get a handle on your feelings. It controls your exhalation, so it helps you to catch your breath. So when you're feeling puffed and you're breathing really like this, and you've got your upper chest pattern of breathing happening, it helps you to feel more in control of your body by just purely slowing down your breathing, your exhalation. So we do a similar kind of exercise. So relaxing your neck and shoulders. So you can do this when you're doing your high intensity interval training. You can do this when you're doing any exercise. Inhale through your nose, and then pucker your lips like you're going to blow out through a straw, and exhale slowly by blowing out through your lips. So in and out. And that actually can really help you feel more in control of your body and in control of your exercise. And people use this when they're starting to do, if they want to do couch to 5K, or if they just want to start doing some sitting exercises, this can be really helpful to help you improve your fitness in quicker than if you're just getting yourself puffing. So doing your breathing control while you exercise is really important. So breathing to improve your fitness. As I said before, the studies have shown that you can use your breath control to improve your fitness. So practicing breathing while you're exercising, so while you're walking or running, if you breathe in for 3 steps and then out for 4 steps, if you're puffed, use your pursed lip breathing to help you control your breathing out. When you're swimming, you breathe out for 2 strokes. So you do, your left, right, and then breathe. And if you've ever done swimming training, you can do 3 strokes. Swim, 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 breathe, swim, swim, breathe, swim, swim, breathe, swim, swim. Or 4 strokes or 5 strokes, or if you're really keen and you've got a nasty coach, you can go all the way up to doing 10 strokes between breaths. And if you look at the Olympic swimmers, when they're swimming their 50 meters, they don't take a breath. They just dive in and they just pump it out. So there's lots of really interesting things that we can talk about with regards to breathing and exercise. And so lots of people do Pilates or yoga. So remembering when you're doing that sort of exercise to breathe out on the harder movement and in on the easier movement. And this actually helps you to more access your diaphragm and to actually use that to help you control and give you more stability in your body. So I have a few questions for you. Do you feel tense? Do you feel like your hands or your feet are cold? Do you notice yourself yawning? Do you notice yourself breathing through your nose, through your mouth at night? So you might wake with a really dry mouth. And the last question is that probably the most challenging for us as people with MS is, can you hold your breath for 25 seconds? Now, I can't hold my breath for 25 seconds. I'm working on it. but it's a very good thing to practice. So you breathe in and then breathe out. And you can keep your breathing in and out just for a moment. And I'll tell you how long 25 seconds is. I'll count the seconds and you can listen and see when you run out of air and you have to take a breath. So we're doing this on your breathing out. So breathe in and breathe out. And now hold your breath. I'll do it in counts of 5. So that's 5 seconds. That's another 5 seconds. That's 15 seconds. That's 20 seconds. And that's 25 seconds. You don't have to tell us who did it, but Nicola, don't tell us the names, but did anyone actually make it to 25 seconds of holding your breath out before you had to breathe in again?
I made it to about 23, I think.
Well done.
Yes, a few people made it.
And did 20 seconds, and I was like, oh, I've still got a lot of work to do. That's good.
Yes, a few people made it, which is fantastic.
But actually doing that breath hold, you don't have to do it very often, but if you practice it once a day, you'll find that gradually that in combination with your breathing practice can really help you to increase your breathing control. So what can you do if you struggled with any of these questions? You can talk to your physiotherapist. You can talk to a yoga instructor. As I said, lots of people recommend, yoga as the solution to solve all problems. And actually, it probably does solve a lot of problems. But they really are onto something. So if you need some more support, there is support out there. So breathing is free, and it is something that you can work on without too much guidance. The key is practice, practice, practice. So we can aim for practicing 2 sets of 30 breaths. We just start off with 10 breaths, and over a couple of weeks, you can just every week, you can add another 5 breaths until you get to 30 breaths. Use a meditation breathing app to help you keep concentrating through your breathing session, so 30 breaths should take you about 5 minutes. But if you use something to keep drawing your attention back, it'll keep your quality, keep you having good quality. So remember, getting distracted is okay. When you realize that you're distracted, just draw your attention back to your breathing exercise. Go, I've gotten distracted. That's okay. I'm going to go back to concentrating on my breathing exercise. Okay, so life is not measured by the number of breaths we take, but by the moments that take our breath away. So keep breathing. Any more questions?
Jen, we've got a couple of questions, but some of them are a bit personal. So I think what I might do is email them to you.
Yep,
and
sure.
If the answers are of general interest to the group, I will distribute the answers to the group. Can I just say a huge, huge thank you? And lots of people have been texting in their thanks and how useful they're finding it. I like to start my day with 7 mindful breaths and long, slow exhale, and I really think that helps to set up my day really well. So just when I lie in bed at the beginning of the day, and I love your little square breathing visual, and I think that might be really helpful for people. It's on your handout so people can find it. And I really love what you said, Jen, about breathing is a tool to increase our hope, initiate change, and feel more empowered. And I'm also going to breathe out for those photos in future as well. So thank you for that hot tip. So big thanks, Jen. Beautiful, beautiful information, and really encourage.
Pleasure.
Thank you. I really encourage everyone to practice, and we will follow up on those questions that we haven't had chance to answer in the webinar, guys. I'll just put my webinar webcam on. So guys, just want to remind you of the many services that we have available for you. We've got allied health with NDIS, we've got plan and support coordination for NDIS, we've got our wonderful team at MS Connect who are there to answer any of your questions. We've also got nurse advisors and social workers, fantastic team in employment support. We've got peer support. So if you feel that you'd like to speak to somebody in a similar situation to yourself, which can be profoundly useful, then please do get in touch with us. We have a great podcast series on a huge variety of subjects, from sex and sexuality to mental health to bladder and continence. Tune in, have a listen. I'm sure there's something there that you'll find useful. Our webinar library has got all our webinar recordings there. Have a look on our website. Type in webinar library in the search panel and have a look there. So if you need to contact us, please use our MS Connect number 1800 042 138. All our contact details are there. Huge thank you to you, Jen. Beautiful information. And thanks to everybody for joining us. Wishing you all the very best for 2022 and look forward to you joining us on our other webinars. We've got a wonderful webinar coming up with Chrissy Barrett on Healthy You for 2022. Chris is an amazing wellbeing expert, and I'm sure you'll get some fantastic information around habit change and how to have a really fabulous 2022. So look forward to seeing you next time. Bye for now.